The CELON method is a minimally invasive, gentle, and user-friendly treatment for the thermal ablation of tissue. This video demonstrates how to use bipolar radiofrequency-induced thermotherapy to reduce the volume of the inferior turbinates. You can perform the procedure on an outpatient basis using local anesthesia. For topical anesthesia, cotton swabs soaked in a 2 to 4% lidocaine solution are suggested. Place the swabs around the inferior nasal conca for about 3 to 5 minutes. To make sure your patient experiences no pain during the procedure, 2 to 3 milliliters of a 2% adrenaline-free lidocaine solution should be injected into the inferior turbinates. The injection of lidocaine also increases the volume of the conca during the treatment, which can reduce the risk of mucous membrane damage. Therefore, don't administer vasoconstrictive substances prior to the procedure, as these would cause a temporary reduction in the volume of the nasal conca. Now use the CELON Pro Breath applicator to treat the turbinates. For this procedure, a power setting of 15 watts is recommended. You can use a higher setting of up to 20 watts to treat smaller noses, for instance when you are treating children. The higher the power setting, the smaller the area of coagulation. Insert the applicator into the anterior end of the inferior conca. The first coagulation should be done in the upper part of the turbinate. After positioning the applicator, activate the power supply by pressing the foot switch. You can monitor the status of the coagulation via the acoustic signal. The power supply is reduced automatically to prevent overdose effects. Now reposition the applicator by pulling it out slightly without removing it all the way. Insert it posteriorly beneath the mucous membrane. Place the electrode as close as possible to midway between the bone and the mucous membrane. Depending on the patient's anatomical features, for example if they have a deviated septum, it may be necessary to use additional insertion points near the middle or the posterior end of the conca. To achieve coagulation along the entire length of the nasal conca, withdraw the needle repeatedly by around 1.5 centimeters and reactivate the power control unit. You can use the 1 centimeter markings on the shaft of the applicator as a positioning gauge. Leaving untreated areas between the lesions will reduce the risk of crusting and improve healing. Repeat this procedure until the hypertrophic areas of the nasal conca have been treated. If the mucous membrane turns white, interrupt the power output immediately by releasing the foot switch and reposition the needle. This will avoid injuring the mucous membrane and prevent unnecessary crusting. After 3 weeks, you can expect a visible reduction in volume as a result of scarring and the body's resorption of the coagulated tissue. Your patient may experience temporary difficulties breathing through their nose until the swelling goes down. The use of postoperative saline solution and mild nasal ointments is recommended. Nasal packing is usually not necessary since there is normally no bleeding. Schedule a follow-up visit with your patient for the following day in order to check the results and to remove any fibrin formation. If your patient's breathing has not improved after 3 or 4 days, it might be necessary to have a second postoperative checkup and clean. Additional CELON treatments of the turbinates is usually unnecessary. Olympus wishes you much success using the CELON method. For further information, please see the procedure guides or visit our website